Tonight on PrimeTime Politics, pushing back against the government's new rules for hybrid work. Unions are angry about civil servants being ordered to the office at least 3 days a week. A top leader from the Public Service Alliance of Canada tells us why. A hectic week in the House, with a budget bill now before MPs, uproar over language, and calls for the Speaker to resign. Our political observers weigh in on the fallout. And with more Canadians struggling to access primary health care, fewer medical students are choosing family medicine. We talk about how it happened and what needs to change with Dr. Danielle Martin from the University of Toronto. This is PrimeTime Politics. Hello, I'm Andrew Thompson in for Michael Serapio. We start with changes coming to hybrid work inside the federal government and the pushback from public sector unions. Starting in September, core civil servants are expected to be in the office a minimum 3 days a week. For most, the rule had been 2 days. Meanwhile, executives will need to be in person at least 4 days a week. The Treasury Board says it's meant to reflect what's happening in other governments and in the private sector and bring the benefits of more in-person collaboration. Let's talk now about the response from workers. Sharon DeSousa is National Executive Vice President with the Public Service Alliance of Canada. Thanks for being here with me.
And thank you, Andrew, for having us.
I want to start with what your union has said. You've been calling this decision a violation of the collective bargaining rights of thousands of workers. However, on the flip side, we have the federal government saying that it's the employer, it has the exclusive management right on where employees work and requiring them to report to the office. Is that not true?
Well, what I can tell you is they have an obligation to consult, and they have an obligation to follow collective agreements. And right now they're doing neither. And that's the problem. And I can also tell you without a doubt, there's federal public sector workers who've been in 2 days a week, and it hasn't been working out. There's some who do not even have a desk, or there's no space. They're having meetings in cafeterias and in hallways, or they're working at a desk and connecting virtually. There's also infrastructure problems where there's lead pipes where people are bringing in their own water. So if you can imagine, if you can't make 2 days a week work in the office, how are you going to make 3 days a week? They should have consulted and dealt with the issues in the workplace at the very minimum.
And have you heard anything more since this announcement has been made from the government?
No, we haven't heard anything further.
Okay, now, your union has said that you're going to be filing an unfair labor practices complaint, that you're also considering more legal options. Can you be a bit more specific about what that's going to look like over the coming days, weeks, months?
Well, what I can tell you is the fact that we're currently in bargaining for our border officers. And in fact, this is one of the demands that we're negotiating. So it was very much a slap in the face to them, the lack of respect, because bargaining should be done at the table amongst the two parties. It shouldn't be unilaterally put in front of the public like this.
Okay, now I guess I want to take the conversation a bit broader to how Canadians are looking at this. Your members can still work from home 2 days a week. Many Canadians can't do that at all due to the circumstances of their job, or if their employer in the private sector doesn't allow it. Why do you think Canadians watching this should be sympathetic to the cause of public servants?
Well, without a doubt, this is Canada's largest employer. Really, the largest employer that's setting the trend for what work looks like. And we know studies, the data, all provide proof that working from home makes a happier employee, but also makes a more productive employee. The nature of work has changed, and we know without a doubt that this is more effective. So why would you make the decision when we know that being in the office isn't going to be more productive? It's a very archaic ideology to say that a butt in a chair in an office is going to be more productive. And we're not the private sector. We are the public sector. They provide public services. And that's what we need to do, is to provide that service.
Okay, I want to ask you as well, though, there are some exceptions noted in that directive for pre-pandemic remote workers, for Indigenous employees whose location is critical to their identity to be able to work from their communities, and people who have permission and live more than 125 kilometers away. And we also know there are some exemptions on a case-by-case basis. So why don't you believe that's a reasonable approach to take?
Well, without a doubt, we all know that a cookie-cutter approach doesn't work. We know this. That's why we negotiated language, that they are supposed to be looking at this from a case-by-case basis. And what have they done? They've made a blanket announcement. And now, here we are back again with they're not resolving the issues in the workplace. So now we're going to have to look at various recourse mechanisms to challenge it. And the exemptions, for how long? We know in some cases they said they gave a grace period of a year. That just doesn't cut it with public sector workers.
Okay, we'll have to leave it there. We're out of time. Sharon DeSousa, Public Service Alliance of Canada, thank you so much.
Thank you.
Let's go inside the House of Commons, where MPs now have the government's budget implementation bill, and where, for a fourth straight day, Conservatives are accusing Liberals of a failed drug policy, and Liberals are accusing Conservatives of ties to extremists.
Mr. Speaker, this government is supposed to be in the business of protecting children, not killing them with exposure and access to hard drugs. The RCMP has confirmed that legal hard drugs are being sold on the black market. In Abbotsford, the Soccer Association has to regularly sweep the needles for pitch. The Legion and many businesses in Mission have to deal with crack smoke every day. When will this government do the right thing and cancel their ideologically extreme experiment to legalize hard drugs and start protecting BC's children?
Hear, hear. The Honourable Deputy Prime Minister and Minister of Finance.
Mr. Speaker, as a mother of 3, including teenagers, I care so much about Canada and Canadians, and I agree, opioid addiction is a tragedy. It is a public health tragedy, and it is a public safety tragedy. But let me tell you what is putting the public safety of all Canadians at risk: consorting with white supremacists and misogynists. That is a public safety risk. The Conservatives have an opportunity today to disavow that. They should do it.
All right, well, let's bring in our political observer panel to talk about what's happening in the House chamber. Susan Smith was a longtime Liberal communications staffer and now co-founder and principal with Blue Sky Strategy Group. Sean Murphy is a former chief of staff to the Conservative whip, now principal with Earnscliffe Strategies. And Anne McGrath is principal secretary to NDP leader Jagmeet Singh. Welcome back to all three of you. Sean, I want to begin with you. We've had a couple days of at least more relatively serene question periods, I guess you could say, compared to what we saw on Tuesday. Still, we've had Conservatives calling for the Speaker to resign. Greg Fergus not giving any indication that's going to happen. So where do you see this story going now? Well,
I think the way it played out this week, the Speaker did the government no favors in terms of the attention that this issue has gotten. I think the amount of chaos that unfolded in the House on Tuesday in question period, with the leader of the opposition getting kicked out, it actually, I think it probably drove a lot more eyeballs to QP yesterday. So a lot more Canadians were tuning into this network to watch question period, expecting to see fireworks. And what they saw was the future Prime Minister asking the current Prime Minister about a policy that's been absolutely devastating for communities in this country.
Susan, how do you think the Liberal Party, the Liberal caucus, is handling this story over the past 48 hours?
I think they found something they can press the Conservatives on, and they found that it worked. They made Pierre Poilievre so mad this week that he lost his mind and went wacko in the House of Commons and was very un-prime ministerial in waiting, and got censured by the Speaker for it. So I think the Liberals are trying to present a reasonable tone. They've asked the Leader of the Opposition to disavow Diagolon, which is a far-right extremist group. They've asked him to explain why he's hanging out with people with, convoy-type signage at the Quebec-Ontario border, and he's allowing that to continue to go on. So the Liberals are pressing the button. They're trying to manage the tone and dial it down a bit, I think, too. I don't think the shenanigans that happened earlier in the week did anybody a service, but if anything, it showed that Pierre Poilievre kind of can't keep it together if you press the right button on him.
And your leader talked about Pierre Poilievre, saying that he acted like a bully, acted like a coward. Also, the NDP reinforcing support for the Speaker's decision. Where do you see this going now?
Well, the reporting on this has been quite interesting because people are really focusing on this idea that that it was about calling the Prime Minister wacko and calling the drug policies wacko. Really, what it was about was not respecting the role of the Speaker and the authority of the Speaker. And in both cases, it was about the authority of the Speaker. And the Speaker does have authority in that House, and has to be listened to. So I think that's one thing. The other thing is, I would be interested to know how many Canadians even noticed that this happened. I mean, we'll maybe find out in the next few days, I'm sure. But I'm pretty sure it's more inside baseball than we might think. It was, for those of us who watch it, it was quite remarkable. I mean, I was quite surprised to see what was going on. I was especially surprised to see the entire Conservative caucus walk out with their leader. And question period had been building up to a point. I think it's kind of stabilized a little bit in the last couple of days, maybe because of some of the pressure, some of the steam went out. But it was building up to a point where it was absolutely unbelievable. It was like the yelling and the screaming and the taunts and it was so childish, so immature, and so unnecessarily angry.
Right, and at the heart of this, simmering underneath the language, is the issue of drug decriminalization and what the BC government is requesting, a very serious issue. Susan, I guess, what is the political fallout for the parties dealing with that issue now?
I think, to back it up a bit, the BC government wanted to try an experiment with decriminalization. So they worked with the federal government to make sure that there could be exceptions to the laws in order to be able to attempt to try this experiment. It didn't work. So now they've said to the government, the feds, it didn't work, you can reverse those things. So the feds, I think, are doing what they need to do, is not just have a knee-jerk reaction, but properly look at things. But there's no question this is an issue. It's a terrible issue in BC. It's a terrible scourge in BC. But I think the Conservatives need to tell the truth on it. There's a lot of, I think Pierre Poilievre, there's footage of him 2 days ago in the House of Commons saying that BC nurses aren't nursing their babies anymore because they are afraid there was poison in the air at the hospital. Like, there's that level of nonsense that's being spit out about it. It's a terrible issue. I think the federal government needs to act responsibly, do the right due diligence, and make a decision, and probably will reverse the policy. I would encourage them to do so. And that is the bottom line issue. It's a public health issue. Okay,
so Sean, I'll let you weigh in, and you can tell us kind of from the Conservative perspective how the party's been handling this here.
Well, I'd say you could see it in the tone that they took yesterday and the tone that they took today. We saw it in the clip at the top of the segment from Brad Biss. They're taking this extremely seriously. And it's not just the MPs in BC, but it's certainly them, and it's MPs across the country who are seeing this, who are hearing this from their constituents in their communities, that the choices that the government has made to date and the choices that they're refusing to make at the behest of the BC government are really having serious and devastating impacts on their communities. And what they want to see is the government take it seriously and not just focus on the choice of words of the leader of the opposition.
Okay, Anne, we now have a budget implementation bill. We've heard NDP leader Jagmeet Singh say the party will support it, but he does have issues that he wants dealt with on the Canada Disability Benefit, on Indigenous First Nations Child Services, I should say. What did the NDP get from the government over the last couple of weeks that wasn't already in place on April 16th when that budget came out?
I think what Jagmeet Singh was able to get was assurances that we would be looking at how to improve the disability benefit, and I think that there are serious issues. Number one, with the amount. I was frankly quite shocked at how low the amount was. I was not expecting it to be as paltry as it was. $200 a month is so little when you consider the need. So I think that there needs to be a real a real attempt at kind of ramping that up and finding a way to improve that. But also there's big issues around eligibility and tying it to the disability tax credit, and issues around what the provinces are going to do, stopping them from clawing that money back, but also encouraging the provinces to also increase the amount that they provide in that. With respect to Indigenous Child Services, Jordan's Principle, which is something that the NDP actually got moved and got through, basically says that when a child needs help, an Indigenous child needs help, that you don't squabble over jurisdiction. You just step in and do it, and then jurisdiction can be dealt with later. And it's not being the timelines for that are not being met, and that is a very, very serious problem. And I think that we got. I think they've acknowledged that we were right about that, and that they have to do something about it. So those are important things. The other thing I should say is yesterday, 1 million people that didn't qualify for, didn't have any dental insurance before, started to be able to get dental care. So there are a lot of things in that budget that we are very proud of. Dental care, pharmacare, certainly the school nutrition program, anti-scab legislation. There's a lot there that I think we can be proud of.
So I guess the question that flows from that, Susan, I'll come to you then, is Anne says there's a lot in the budget. The Liberal government has been out selling that budget, but the polls are not showing, at least yet, a real change in support. We have Abacus data saying the Conservative lead is now up to 21, which is the highest that firm has ever recorded. So what do you think it's going to take over the long term for the Liberals to start, I guess, closing that gap?
Well, I think the gap was a steady decline, and so I would argue that to go up in the polls, it's a steady incline. You're not going to see a precipitous fall off and a precipitous jump that's going to stay for any stage. So I think the Liberals have put together a budget that appeals to some of the things that were really on people's minds on affordability and housing. You need to see that set in, sink in, and traction, shovels in grounds for people to really feel that they're looking hard. Also, the election is far away, right? People don't have to make a ballot choice tomorrow. So they're going to take a look over the next year at the parties, at all the leaders, at who behaves himself in question period, who can't hold their temper, who can make measured and insightful and impactful policy announcements for people. So I would say they need to keep doing what they're doing, because in terms of telling the story of the budget, reaching out to Canadians, connecting to Canadians, and show them how the policies that they're putting forward, they're practical and have a practical implication. But there will be no quick jump. And I don't think it makes sense to think that there would be an immediate quick jump. Okay,
and Sean, I want to talk to you about the Conservative handling of the budget, because we do have this situation where the Liberals have left their changes to the capital gains tax outside the budget bill. So if it's going to be a standalone bill, perhaps that would make Conservatives have to vote specifically on that. Now, the finance minister has said no, that's not why we're doing this, but we do have sources telling reporters that it is a reason why. So how are the Conservatives going to be handling this issue of the capital gains tax, which is one of the parts of the budget really that has gotten the most attention from Canadians?
Mm-hmm. I'd say, first of all, they have been desperate, the Liberals have been desperate to have this fight for 2 weeks. And they tried when they tabled the budget, and the Conservatives didn't take the bait. And they're trying again now by separating it out and having a standalone piece of legislation to hope to have a debate and vote on that. But I think, their claims that this measure is going to impact a very small number of Canadians. Conservatives are going to continue to be focusing on the tax measure that is impacting 100% of Canadians, and that's the carbon tax. So the affordability issues are still top of mind. The fact that the carbon tax is driving up the costs on gas, groceries, and home heating, they're going to keep talking about that. So the government is going to keep trying to find different distractions, capital gains being one, the things that Susan mentioned earlier as well. I think Conservatives and Pierre Poilievre are going to continue to drive the narrative in the country, and that's why you're seeing the polls the way they are.
Okay, Anne, I'll give you the last word.
I will say that I've seen a lot of polls in my lifetime, and they're almost never a predictor of something that's going to happen, months, maybe a year away. They're not a predictor. I worked with Jack Layton as his chief of staff. He was the leader for 8 years. The entire time he was leader, the NDP was between 16 and 18% in the polls. And we went into the 2011 election hitting 20% for the first time during his leadership and won 103 seats.
We'll leave it there. And Susan, Sean, thank you so much.
Thanks, Andrew.
To the public healthcare system now, as an increasing number of Canadians are finding themselves without any form of primary care. Back in 2022, StatsCan estimated that 14% of Canadians do not have access to a regular healthcare provider. Another survey in that same year from the Our Care project led by the University of Toronto suggested the numbers were even worse, with 22% not having that primary care. And the picture does not seem to be getting any better, with medical students being less likely to choose family medicine as their career path. To talk about this, Primetime Politics host Michael Serapio spoke with Dr. Danielle Martin. She is the chair of the Department of Family and Community Medicine at the University of Toronto's Temerty Faculty of Medicine.
Dr. Martin, good to see you again. Thank you for joining us.
Good to see you too. Thank you.
Now, according to the Canadian Institute for Health Information, family doctors make an average of $299,000 a year in this country, so very well paid. Why are med school students shying away from family medicine?
Well, it's a complex thing, and I think, you know, the numbers can be interpreted in different ways, but I think the bottom line is that we do have to make sure that medical students are excited about the possibility of a career in family medicine. I've been a family doc for almost 20 years now, and I wouldn't make a different choice. I love my job. But of course, there's more than being well paid to make people have satisfaction in their job. And one of the things that we do know is that as the healthcare system has struggled in the post-pandemic world to meet needs, a lot of the burden of trying to help our patients navigate healthcare systems has been falling on family docs. And so how does that show up? It shows up as a increasing administrative burden, more time trying to navigate, trying to get access to services for patients. The complexity of people's illness is rising as the population ages and people have more chronic diseases. It's becoming a harder job. And of course, you know, just as inflation has hit every sector of the economy, those family docs out there that are running a small business are experiencing costs at a higher level. And all of that gets transmitted to our learners. So there are things we can do in education to make people more excited about a career in family medicine, but there are also things we need to do to fix the health system, make it a job that is joyful and that brings meaning to people's careers. And our students are looking for signals that they can have a long and happy and fulfilling career as family doctors, and we're not yet delivering enough of those signals to them.
Mm-hmm. Well, I know the Ontario Medical Association, which of course is the province that we're in right now, they do suggest that the province adopt a number of different measures, like creating a centralized intake and referral system, using AI to take patient notes, which I know there's a pilot project on that right now, reducing the number of sick notes and referral letters. You know, I'm wondering, if you talk about the administration and the difficulties of running a business, essentially for family doctors as a challenge, does it require a central government agency or some type of computer interface that provinces would administer instead of doctors to remove that away from what they have to deal with?
Well, we know that our learners overwhelmingly tell us that they are less interested in running a small business and more interested in focusing their efforts and their energy on practicing medicine. But I don't think that we can say that every doctor in Canada, every family doctor would just sort of hand over their business to the government. I don't think that that's a likely outcome. And so what we know our new grads are looking for, and what the models that we want to be building going forward for people graduating are, I think, going to be less about that kind of entrepreneurship and more about the ability to walk in to a clinic that is well set up, that is well run, where you have a team, and that's really important. I mean, if you think about, you walk into a hospital, the surgeons are not, paying the nurses out of pocket, out of their billings. They're not hiring the dietitians and the social workers. They're not choosing the computer system. You know, that infrastructure exists in hospitals, and we need to be building it in the community to support family doctors and other primary care providers, clinicians, to do their jobs. And so thinking about what does that infrastructure look like that would be attractive to a new graduate. We know that our new grads are increasingly women who may take parental leave. We know that our new generation wants to have some level of balance in their lives. I mean, so do all the generations, actually. And so thinking about the capacity to hand over your practice to somebody for a period of time because you're having a child, and then being able to come back and know that your patients have been taken care of, and to be able to work in that team environment where there's a pharmacist I can consult on a difficult medication question, or a social worker who can do psychotherapy for my teen patient who's having a mental health crisis. Those are the things that we need to build. And I don't think it's about government taking over. It's about building models that, yes, are publicly funded so that all of our patients can have access to them, that will support family docs to do a good job for our patients. And knowing that you have a team and an infrastructure around you is part of what makes people feel secure. And people want security when they're making a lifelong career choice. So all of those things can matter.
And sorry to jump in there, but I appreciate what you're saying. Not every doctor in the country may be eager to surrender what has been a private business, but it seems to be what you're suggesting is almost the model going forward, that perhaps, for example, because I know it's been floated, doctors become an employee of the province and get a salary rather than billing per patient. Is that the type of model? It's future casting rather than trying to deal with what currently exists?
I'm not sure that doctors would become employees of the province. We don't have that model in hospitals now, but certainly we do have models that exist in primary care, like community health centers, where doctors are employed by the health center and they're salaried and they have a pension and they have paid vacation and all of those things, and they work in a team. And there are also other models that we can be looking to. So, a doctor doesn't necessarily have to be fully employed and salaried, but can be working in a team-based model where they're drawing a steady income. There are lots of different ways to set it up that gives them some stability and allows that infrastructure piece to be taken care of. So I think it's I'm not sure that the provincial and territorial governments are going to want to get in the business of employing doctors either, but I do think that we can be doing something closer to stability for our new graduates, and there are lots of different ways to structure that would be potentially attractive to a new grad who's not interested in running a business. Ultimately, I think it's less about, is it an employment model and a salary model, and more about, is it a model that gives people some predictability of income, some predictability of support, so that they can come in and out in those early career years when people are building a family, knowing that their practice will be taken care of. And that team, I cannot emphasize enough how important that team is, both a team of medical colleagues who can cover you so you can take a vacation or whatever it is, and also a team of interprofessional colleagues who can help you to manage what is an increasingly complex job. I mean, when we look at the seniors who we take care of in our family practices today, it's not uncommon for people to, need 3 or 4 different specialists. You're trying to coordinate and quarterback that care. They've got 12 medications. Some of them are homebound. They need a lot of support, and we, as family docs, want to give that support. It's an honor and a pleasure to do this job, but to do it alone, without any backup or support around you, is not a credible model.
Dr. Danielle Martin, we could go on this, but I do want to thank you for the time. Really appreciate the insight.
Thanks for having me.
And that was Michael Serapio with Dr. Danielle Martin. And that is Primetime Politics for Thursday. I'm Andrew Thompson in Ottawa. For all of us at CPAC, thanks for watching. Good night.